Hyperthyroidism is an increase in the thyroid hormone level. Now, this increase can be due to any cause. Like basically, the thyroid hormone is being released from the thyroid gland. So there can be any defect, any disease that is affecting the thyroid gland, and in consequence there is an abnormality in the release of the hormone. So let's see what can be the different reasons of thyroid gland disease that can lead to the hyperthyroidism. First of all, there is the Graves' disease. Graves' disease is an autoimmune disease that basically produces antibodies. These antibodies bind to the cells on the thyroid gland and cause excessive production of the thyroid hormone. You can say that they basically stimulate or facilitate the process of the thyroid hormone production from the thyroid gland. Now, thyroid hormone is, that thyroid hormone is produced within the cells of the thyroid gland, and there thyroglobulin is present that is iodinated, and then T3 and T4 hormone is produced. Now, the antibodies, instead of the TSH hormone, the antibodies bind to the TSH receptor that lead to the excessive production of the thyroid hormone and results in hyperthyroidism. Then there is intrinsic thyroid disease. Now, intrinsic thyroid disease means any disease of the thyroid gland that can be any infection, any inflammation, or any sort of adenoma of the thyroid gland that can lead to hypersecretion or hypertrophic state of the gland. This will obviously lead to an increase in the level of thyroid hormone in the blood. Then another reason is the extrinsic thyroid reason, or extrinsic thyroid disease can be the reason. Now, this is in very rare cases that the patient may suffer from the pituitary adenoma. Now, if you remember, the thyroid hormone is released under the influence of the thyroid stimulating hormone that is released from the posterior pituitary. So again, posterior pituitary plays an important role in the release of the thyroid hormone. So whenever there is any disease to the pituitary gland, like here the pituitary adenoma, that is a hypertrophic condition of the pituitary gland, more TSH will be released, and that will lead to excess in the thyroid hormone production and excess level of thyroid hormone in the blood as well. So these are some three major causes of thyroid gland disease or hyperthyroidism.